Good afternoon. Thank you, everyone, and thank you, Speaker Pelosi, for this opportunity to say a few words. I want to express my belief in the core moral principle that everyone standing here today has already expressed, that quality, affordable health care is the right of every child, woman, and man in our country, not a privilege just for those fortunate enough to have it. As part of our efforts to make this principle a reality, we need to build on the successes of the ACA and ensure that every American can get health coverage, protect people with pre-existing conditions, and lower the rising cost of health care. I'm proud that this effort includes a bill that I've put forward, the Family Health Care Affordability Act, a bill to fix the ACA's so-called family glitch. This glitch in the system has prevented some workers from being able to expand their employer-provided insurance to their families by disqualifying them for the subsidies they need to be able to afford coverage for their spouse and their children. My bill is a small fix to a big problem for many working families. This, alongside our sweeping legislation to stabilize and strengthen the ACA and protect people with pre-existing conditions, can help every family across our nation get health insurance. As a representative of a district with as many Republicans and independents as Democrats, I can tell you this: it is not a partisan issue. When my constituents gather around their kitchen tables, they aren't talking about party or ideology. They are talking about how they're going to afford their premiums this month. They're worried about the same unsustainable healthcare costs and gaps in coverage. On behalf of working families in my community and yours, let's work together to improve the lives of millions of Americans by building on the promise of the Affordable Care Act and strengthening our healthcare system. Thank you, and at this point I turn it over to Representative Angie Craig from the Green